Hi, my name is Laura Johnson, and tonight I'm going to present you on a case study for this discussion in Human Services 1750, Case Management and Ethics. Just give me a moment while I share my screen and I'll get started on my case study. So, whoops, I just jumped the screen, I apologize. So this case study is about ethical challenges faced in dual relationships. I'm going to present you with a case study again about confidentiality in dual relationships, in which a counselor discovers that her client is a family member of her longtime close friend. I'll present you with the ethical challenges that the counselor will face while maintaining professionalism and integrity during this dual relationship. So we're going to talk about Counselor Emily Lee and her client, David Brown. A little background. So Counselor Emily, she is a licensed therapist, and she began seeing a new client, David, for anxiety and depression. David recently moved back home after living out of state for the majority of his adult life. After a couple of sessions, Counselor Emily realizes that David is the brother of her close friend, Sarah. Counselor Emily and Sarah, they have been friends for over a decade, and they often share personal details about their lives with each other. Counselor Emily is now in a dual relationship as she has a personal relationship with her client's sister. This creates a conflict of interest and could potentially harm her therapeutic relationship with David. Counselor Emily needs to avoid any interactions with Sarah that could compromise her fairness and her professionalism with David, allowing her to maintain integrity in their therapeutic relationship. Ethical challenges. So I'm going to talk next about the ethical challenges in this case study that Counselor Emily may face. Confidentiality. So since balancing personal and professional interactions can make it difficult to maintain strict confidentiality, Counselor Emily needs to make sure David's information remains confidential and that it is not shared with Sarah, even though they are close friends. This will be key to maintaining trust with David in their therapeutic relationship. It's also a means to remain professional, and it'll help avoid any confidentiality breaches. The next ethical challenge that Emily may face is boundaries. So, since this situation could make David uncomfortable, Counselor Emily must establish clear professional boundaries with David's sister to avoid conflicts of interest and to ensure the therapeutic relationship remains unaffected by their mutual connection. Counselor Emily could struggle to maintain a clear separation between the professional relationship and her personal role as a good friend of David's sister, Sarah, which ultimately affects her objectivity. The next ethical challenge Emily may face is objectivity. So since this dual relationship can complicate Emily's ability to prioritize her client's best interests, she must remain neutral to ensure her personal relationship with David's sister, as it could lead to biased treatment decisions as well as favoritism. The next ethical challenge Emily may face as a counselor in this dual relationship is transparency. So Counselor Emily needs to discuss the potential conflict of interest with David. Be transparent, providing him with an option to continue therapy with her or to give him the option to seek another counselor. The next ethical challenge Emily will face or could face is professionalism. Counselor Emily should adhere to ethical guidelines and consult with her supervisor or with her peers to plan her course of action during this complex situation to ensure nothing compromises David's care. That is ultimately her number one goal. There could also be the ethical challenge of unequal power dynamics. So David, he could feel less empowered to share certain things with Emily, which could greatly hinder the therapeutic process. It can also lead to exploitation as well as favoritism. The next ethical challenge is there could be emotional strain. So both Emily and David can experience greater emotional strain due to the dual nature of this relationship. Resolution. So to maintain the utmost integrity in their therapeutic relationship, Counselor Emily decides to discuss the situation with David, to be transparent during their next appointment. She explains the possibilities of the conflict of interest and provides David with the option to see another therapist if he feels uneasy about it. Counselor Emily also sets clear boundaries with Sarah, ensuring that she does not discuss David's therapy or any personal information with her. So in addition, Counselor Emily will still document thoroughly. So she will maintain detailed records of ethical decision-making process, including the rationale behind her chosen action. She also needs to stay informed about ethical updates. So she also vows to regularly review the latest developments in professional ethics to ensure that her practice remains aligned with the most current standards. The outcome? So David appreciates that Counselor Emily is transparent and he decides to continue therapy with her. He feels reassured by her ability to remain professional, even though she's good friends with his sister. Counselor Emily maintains her ethical responsibilities, ensuring that both confidentiality and professional boundaries remain in place. So this is the end of my case study. I hope you enjoyed it, and I hope you learned a little bit about challenges, ethical challenges that a counselor can face during a dual relationship. Thank you.